Hi everybody, in this video I'm going to try and demystify myths which are very prevalent with the general population. This is Dr. Ravindran Kumeran from Apollo Firstment Hospitals, Chennai. I am a surgical gastroenterologist and I hope this video is useful. Very frequent complaint which you hear from patients is constipation. Now, constipation usually means hard stools which are infrequent. For example, if a patient does not open their bowels at least 2 or 3 times a week, then that is often referred to as constipation. Very hard stools is also referred to as constipation. It's a very broad topic, right? You have a lot of people who get very upset when they do not open their bowels every day. Now you have to understand that there is a lot of variation in our diet and all of us eat differently, and often a lot of us are on different medications, especially the elderly population. They may have medications for diabetes, blood pressure, heart problems, kidney problems, so on and so forth. Please understand that any of these medications can alter or upset your normal bowel rhythm. Now, if you're somebody who's good enough to have a bowel movement every day without any issues, now this balance can be upset by just taking a short course of antibiotics, for example. Now, any of these medications can upset. Now, when people are on a lot of medications for various diseases, invariably they will not have a happy bowel habit. They would say it is not as good as what it was once upon a time. Now you have to understand that any new change which is related to a medicine or which is related to a procedure which we have done, then it is acceptable. You do not have to worry about it. Any long-term change which happens over a few weeks, now if you suddenly talking about a change which was not there a few months ago and it is persistently happening for a few more weeks than what you would expect it to carry on, then that may be a cause of concern and that probably warrants a medical consultation. Just not going to the toilet one day doesn't mean anything. You can even going 3 times a day is fine for some people. Even going once in 3 days is fine, as long as it is the norm for the patient. So just because you do not have a bowel movement every morning at a particular time, I don't think you have to stress yourself at all. If you have a healthy, balanced diet, if you're able to have enough green leafy vegetables, in other words, high fiber diet, if you're able to drink plenty of clear liquids without any kind of fluid restriction, then most people are fine. And if you are still concerned and if the symptoms persist, then yes, it warrants a medical consultation. Thank you.